food detective identifies raised IgG antibodies to foods, which may be involved in various conditions such as irritable bowel syndrome, migraine, eczema, and arthritis. It is recommended that you watch this video at least once before performing the test on yourself. Please ensure that all the components to do the test are present in your kit. Obtaining blood. Wash your hands in warm water, as this helps to soften the skin and encourage blood flow. Remove the cap from the bottle containing solution A. Remove the protective cap from the safety lancet. Select the finger to be pricked, either the middle or ring finger, and clean with the sterile wipe provided. Allow to dry thoroughly before proceeding. Place the raised end of the safety lancet onto the chosen finger. Push down the lancet firmly. A slight prick may be felt as the skin is punctured. Gently massage the finger in the direction of the puncture to obtain a drop of blood. Ensure the following when collecting blood. Only proceed with the test when the recommended amount of blood is collected. Do not squeeze the bulb of the micropipette. Hold the micropipette horizontally throughout the procedure. If it is held vertically, blood cannot be drawn into the tube. Do not cover the small ventilation hole denoted by a black line with your finger. This will prevent blood from being drawn into the micropipette. Do not open the foil pouch containing the reaction tray until a blood sample has been successfully collected. Gently hold the bulb of the micropipette and bring the tip to touch the drop of blood. Blood will automatically be drawn up to the black line and fill the micropipette with the required volume. If on the first attempt you have difficulty obtaining a blood sample, you may need to use the spare lancet and micropipette on a different finger. Once you have collected sufficient sample, immediately squeeze the bulb of the micropipette to dispense the blood into solution A. Replace the cap securely and mix gently to disperse the blood fully. A darker solution color may be observed upon addition of the blood. This is perfectly normal. Conducting the test. Remove the reaction tray from the foil pouch. Pour the entire diluted blood sample in solution A into the reaction tray. Gently swirl the reaction tray to ensure that all the wells are covered with the solution. If air bubbles are present in any of the wells, tap the reaction tray gently until they dislodge. Leave for 20 minutes at room temperature away from direct sunlight. After 20 minutes, empty the reaction tray into the sink. Pour enough solution D containing wash solution into the tray so that the entire surface is flooded. Agitate vigorously for a few seconds to wash and then empty the contents of the tray into the sink. Repeat this washing step 3 more times. Add all of the solution B containing antibody detector solution to the reaction tray. Gently swirl to again ensure that all the wells are completely covered. If air bubbles are present in any of the wells, tap the reaction tray until they dislodge. Leave for 10 minutes at room temperature away from direct sunlight. Empty the reaction tray into the sink. Pour enough solution D containing wash solution into the tray so that the entire surface is flooded. Agitate vigorously for a few seconds to wash and then empty the contents of the tray into the sink. Repeat this washing step 3 more times. Add all of solution C containing developer solution to the reaction tray. Ensure that all the wells are completely covered, and if air bubbles are present in any of the wells, tap the reaction tray until they dislodge. Leave for 2 minutes, away from direct sunlight. Blue dots will appear in the wells where reactive foods are present, along with the positive control. Empty the reaction tray into the sink. Gently wash once with solution D containing wash solution. Empty the contents of the reaction tray into the sink. The test is now complete. Reading the results. Read the results immediately after the test is completed. Identify which wells on the reaction tray have produced a blue spot, and refer to the diagram in the step-by-step instructions to identify the individual foods. Mark the reaction for each food on the results card provided in the kit to record your test results. Wells with dark blue spots indicate that a strong positive reaction has occurred. Wells with paler blue spots indicate that a milder reaction has occurred. If there is no colour present, this indicates a negative result. If only a ring of colour is observed round the top of a well, the result for this well is invalid and should be disregarded. Positive and negative controls indicate that the test has been conducted correctly. For the test results to be valid, position 47 must be white at the end of the test, and position 48 must be blue. Dietary advice. If you have tested positive for one or more foods with the food detective test, we recommend that you seek advice from a qualified nutritionist or healthcare professional before making changes to your diet. In the event of difficulty in obtaining blood, please contact Cambridge Nutritional Sciences for advice.